Good afternoon, everyone. Today is August 11th. This is our virtual town hall, the weekly time that we dedicate to talking about some of the more specifics related to COVID-19, the coronavirus, how we are as an organization, how we were managing affairs. I was looking back through some of my PowerPoints that we've used to support these broadcasts, and just thinking back to when we were at 34,000 dead, or amounts much less than we are now. We've certainly discovered new things about ourselves, I think, as an organization, but also as a population of the United States, of the world, and how we're seeing this virus impacts so many areas of life. And as we've been talking about the last few weeks in particular, have been how we endeavor to reopen our day programs, which have been closed since March and recently opened a week ago Monday. And so in a few minutes, I'm going to ask Ted Horn and James Sannon to join me to have a kind of conversation about where things are. And where they are is constantly moving and constantly shifting. I was on a call this morning, two calls, one with the ADDP, statewide ADDP call, and then one with our regional TDS. And we are proceeding very cautiously because there has been an uptick in the number of cases in Massachusetts, in particular Region 3. Some of you may remember that the Northeast region, of which we're a part, was hit particularly hard in the beginning. And while we here at NuPath have not experienced any additional new cases, it's something that we're watching very carefully, because we know that our success in opening and staying open is really contingent upon our ability to manage this. And we've talked about how important it is that we learn to live with it, as awful as that seems and sounds and it feels. The anxiety that it provokes, we have to learn to walk in this new highly charged environment, and to do so in a way that's safe. But before we bring on our guest panelists today, I want to spend a couple of minutes just talking about where we are in the number of cases, the number of deaths, something that we've had a tradition of doing. Currently in Massachusetts, there have been 8,700 deaths related to COVID, 121 confirmed cases. That is up from 93 from the week before. The previous week, we'd seen an increase of 112. Looking week to week, it's hard to say what the increases are, but United States, we're now at 163,000 deaths with 5.1 million confirmed. That's up 5,000. Previous week, it was up 7,000. And then the number of global deaths is up at 737,000, with that's an increase of 45,000 from the previous week. And the week before that, it had been 38,000. So globally, it looks like it's gone up a little bit. United States down, as far as not down, but the number of new cases, or the number of deaths, I should say. A recent CNN study or a report, many of you may have heard it because it really made the news, talking about as many as 300,000 Americans could possibly die by the end of this calendar year. It's just a shocking amount. Researchers of this study and doing these projections said that while 159, nearly 160,000 died already, according to Johns Hopkins, that there could be as many as nearly 300,000 deaths by December. And again, talking about how the important correlation between our behavior and the transmission of this virus. And in this particular study, the use of face coverings was stressed once again, that if 95% of the people who wore coverings, the number would decrease, of deaths would decrease to 228,000, saving as many as 66,000 lives. It's just between now and December. But using a face mask, which is so important, can cut the spread of the virus by 40%. So even as we're in the heat wave, and I feel like I can hardly breathe when I go outside and wearing a mask. It's important to remember that while we're wearing the mask, we are doing our part, and we are all contributing to trying to tamp down the spread of this incredibly uh, easily transmissible virus. When you think about mask use, I thought it would be interesting to share this little graphic here that shows these are the states that are currently have laws that are requiring people to wear face masks. One would think that with the studies showing so clearly that it is a way to decrease or to control the spread of the virus, that it would be a national requirement. But you can see that even in the Northeast region, New Hampshire does not have a formal law about that, even as many others do. And so face masks are going to be something that continue to be used. We've been talking about testing as the weeks have gone by, and there are different states that are doing a better job. And I thought it might be interesting to take a look at Massachusetts, where we live. That in the Northeast, we are on the higher end of things. This color blue puts Massachusetts kind of in the second to the highest range of testing. And now there have been 1.7 million tests conducted since the beginning of this pandemic. And that puts us in pretty good standing. Now look at the states above us. Clearly have done much less testing, even as our neighbor New York to our west has done more. We know New York has been at the sort of vanguard of really promoting universal testing or testing for many, many people. And I still believe that's something that is going to be necessary. And in fact, just to keep people's heads in the right space, we've learned, well, we've known for a while, but it was kind of confirmed this morning in the calls that there is will be a mandatory testing of all staff, or at least staff that are working residentially. That's what we know so far, but I think it's going to be all staff. We've talked about this for a while. My own personal opinion that it should be mandatory, and that we need to be encouraging all staff to get the tests. Right now, we are looking at test results coming back from the various labs, the things that we have to our disposal and that we're able to send our staff to. Test results that can come back in within 72 hours or less. In some cases, we're hearing some of the test results taking longer. This is probably going to be the case for some time. We're all hoping that there'll be some tests that becomes available that is much more immediate, something that you can spit in something or breathe in something that changes color, or something maybe a little bit more scientific than that. But so right now, as we're one of our protocols is that everyone who enters our buildings have to have their temperatures taken, and so that is a sign. Having a rapid test would be another layer of protection in trying to promote environments that are free of the virus, and also will notify and would alert the staff person maybe that has it that they do, and that they're able to quarantine themselves while they are likely to expose others. So testing is going to play a big role in our collective experience as we move into the end of the summer and into the fall. Even the very best predictions about the availability of a vaccine put the availability out way well towards the end of the year, maybe even into the beginning of 2021. And then depending upon how those doses of the vaccines are prioritized, we hope that our employees will be considered high priority, since we are working within the sort of human services arena and caring for lives that will be prioritized along with other emergency health workers. But that remains to be seen, and we will have to, figure things out as we move along. So that is the sort of basics of where things stand from a data perspective. As I mentioned, we are have not had any additional cases of COVID in our program, so that's a big relief. And again, I hope I do it enough. Maybe I don't, but I just want to give a huge thanks to our faithful and dedicated and deeply committed staff that are making it so that we can continue to provide our services in a way that's safe and that can bring confidence and reassurance to the families that we serve. Last week on Thursday, we spoke with 3 staff that were kind of representing some of our three of our day programs, and I was really encouraged to hear that the overwhelming sense of confidence these staff had being actually in the programs and interacting with families. And part of the messaging here is wanting to touch families that are maybe on the fence, or they're unsure, or there's some apprehension as to whether or not they are going to have their child return to our day services. And we want to continue to provide you with the most up-to-date information that we possibly have, that our reports to you are accurate, and that we're able to share with you some of the successes that we're having, so that if you hear something that makes you feel more encouraged, that you maybe will take the chance and have your child come back. So now I'm going to ask Greg to bring on Ted Horn, who is our Vice President of Quality and Training, and James Sannon, who is our Director of Day Services. These are 2 people you've seen numerous times in the past. Welcome back, Ted.
Thank you very much.
And welcome, James. It's good to have you here today.
Thank you. Nice to be here.
So I thought that it would be great to have the 2 of you on. You've both been instrumental as we've, as architects of the plan. James, you're a kind of a superstar in the What to Expect video that you and Matt and Elder put together, which was outstanding. I've heard great feedback from it. And Ted, you've of course been so involved in kind of the planning, the technical, sort of all of the numerous steps that have been required in the planning, the preparation, and even in the implementation as we go into this, being our kind of our quality guy, and having at least 2 or 3 manuals that are this thick, of policies that you study. You probably have it right there, don't you? Maybe before the end of this, you could reach for it, just so people know I'm not exaggerating. I am not exaggerating. It is that thing. Because you are expert in that, and because you have a mind for it, I thought you'd bring a perspective of kind of more from like the empirical sort of policy area, but and James would probably be able to fill in some of the blanks for what people's reactions have been and how people have been responding to things. So I don't really have a set order here. I wonder, Ted, if you could start us off by just kind of talking about what's been happening this past couple of weeks from your perspective and your vantage point, and how are you measuring our success or compliance with the guidance that we've been received and that we're trying to follow?
Sure, absolutely. Thank you, Dan. So, to start with, we opened last Monday. And last week was a staggered approach. Dan mentioned that we've taken a very careful approach to this, and we've gone about it cautiously. Going into the first full week of operation of 2 of our day program sites, the New Boston Street site and our Westford Liberty Way location, we have 16 people back at our New Boston Street location, and we have about 10 people back at our Westford location. So, that's a small number, but it's a good number to start with. It's letting us see all of the work that's been happening over the last few months of planning. It's let us see the effectiveness of it and the reality of it. And once I want to answer a couple of questions before I hand it over to James, because James has had his feet on the ground and his eyes in the programs, and he can share what people are experiencing. But how we got there. So, starting off, this approach has been like no other in our experience of program implementation. We are making plans and decisions and implementing as emergency regulations are being written. And we're doing it based on best practices. We're doing it based on guidance from our funding sources and the CDC and the Board of Health. And we're doing it in the best interest of the people that we support. So, so there were some questions about, getting to that 16 people in Boston Street. How did we get there? And I just wanted to, in a nutshell, give a picture of how we are taking a stakeholder base of almost 400 people and communicating in a diligent and thorough way with each stakeholder so that they can make an informed decision as to what's best for their loved one. So I'm going to break it down into two categories, and it's going to be those who do not have formal supports living in the community and those who do have formal supports. And so those who do not have formal supports would be people living with family members at a private residence, or in shared living situation, or living independently in the community. Those with formal supports would be those who have paid staff in a licensed group home. Okay, so that sets the stage of our approach. And what we have, the approach we've done for interest of the people served and their families, as well as guidance from DDS, is we've prioritized those who do not have the formal supports in the community first. And the way we've approached that is in phase A, what we've done is over time, we've been doing weekly reach out calls to everybody that we support. And over that time, the questions have been asked as we've gotten closer to this date, what was the intention of returning to the program? Where was the comfort level? And for those who indicated that there was a desire or need to return sooner than later, they were phase A of what's called a risk benefit survey. And the risk benefit survey is something that's been provided to us by the Executive Office of Health and Human Services. And it allows us to have a discussion about the risks associated with returning to day programming, as well as the benefits, so that every person can make a fully informed decision of what's best. For those who expressed an interest and a desire to return following that discussion, they've started back in the program. For those who expressed an interest and desire to start back, but didn't have transportation, I assure you we are working on that this week. You're going to hear from us as to what possible resolutions there are for that, because there's been the expression of the need and desire, and we want to work with you to facilitate getting to the program. So that's phase A. Phase B are for those people living with families independently or in shared living who weren't ready to return just yet. We're now in phase B of those risk benefit discussions. And even though we fully realize that at this point in time, the desire may not be to come back, we don't want to wait too long to have that discussion, because again, we want to have that part done so that when and if you become ready, you're making a fully informed decision at that point. And then finally, the group homes. The group homes will be in phase C, and that's a bit more complicated process. NuPath has taken the approach that if somebody needs their day programming, they've been able to return to day program. There are other partner organizations who aren't as comfortable with that, and for their own reasons. And so we need to work through, navigate a few more levels with that. But the most important part there is there are formal supports in the home. That doesn't mean that they're the best supports for them. That doesn't mean that the person doesn't want to get out of that interrupted schedule. It just means that we need to process through this. Having said that, yes.
Sorry, I didn't mean to interrupt you, but So, and I want to bring James into this conversation too, but do you get the feeling, I think this is kind of a, how do I say this? Even as we're trying to get people back, we probably have, there's probably a limit of, well, there is a limit to how many people we're going to be able to bring back, because we're not going to be able to maintain the social distancing. So part of the challenge is bringing back a maximum number of people that we can comfortably bring back, but we're not right now trying to get everyone back, right? I mean, there's just going to be some people that probably, in all fairness, are not going to be coming back. So even as our levels, our total number of people coming in now are low, there's a sweet spot that we kind of want to end up in, right? Where we're not going to be, where we're going to be able to make sure that people know that they're safe and
Absolutely. Absolutely. You know, working with the 6-foot distancing in the programs, and for some of our program areas, we need more than 6-foot distancing. And for some of the people we support, we need more than the prescribed social distancing. So no, we are not, there's no race to get back to a pre-COVID census or, you know, attendance level in the day programs. For those people who aren't coming back, either for, you know, at this point, let me step back. At this point, based on our capacity at each program, at this point in time, we don't have a worry that we're going to be turning anybody away. And that's just based on the data that we have right now, based on what people have expressed their intentions right now. However, that sweet spot that you mentioned, at some point as we progress through the fall, there may be that increase in desire to return. And we may get to a point where we just cannot safely support everybody in our existing day program. At this point in time, we've only opened 2 of our facilities. We do have a third. We have the Martin Center, which we've chosen not to open at this time because of the low demand across the board. But there will be, monitoring that sweet spot, and put a number on that, we would anticipate probably somewhere 60% of our pre-COVID capacity to be in that sweet spot that you mentioned.
Right. And to not to get off the topic too much here, but I know that one of the very difficult conversations that some organizations are having, including us, frankly, is whether or not we just have more space than what we require now. Because looking at the, if you take, for example, the Martin Center, where we're dealing with such a fragile population in many cases, that these may be people that just do not even think about returning to well after there's a vaccine that's out, widely distributed, and so on. And so, how organizations are able to manage this period of time where it's very uncertain when we'll be able to reach a level that is from a profit and loss perspective allows us to do business and to reopen a facility like Martin Center. It may be that we're a ways away, or that we may have to make decisions about our sort of inventory of available space. But James, you've been down in the programs. You've had what, I'm sorry, 14, or what is it, 18 you're up to now?
Well, up to 18.
18. So
Yes.
So do you, knowing what you know and how what the space used to look like, what it used to be like, does it feel like super empty? Or with those people back, are you finding it's kind of a challenge to make sure that you're, even with that number of people, keeping people distanced enough and not congested in the hallways and bathrooms and so forth? What's it been like on the ground?
So it's actually been a very positive experience in terms of social distancing and everybody just adhering to the guidelines that we put in place. And surprisingly, people are following the directions. People are adhering to social distancing, and of course, it contributes. Part of it contributes to the low number of people we have attending the day program at this time, and it's been very manageable. I like to relate it as to first day of school. It's almost seemed like it was a summer break, and the new school season just started, and everybody came back that first day, Monday, when we reopened. It was a wonderful experience to be out in the parking lot and to see people's faces, everybody's eyes bright wide open, big smiles, and we wanted so much to hug and give high fives, what we're accustomed to, but we were disciplined. We kindly rejected any hugs and did high fives from a distance. But it was great. It was a great feeling to have a sense of normalcy, to see the staff back, and it went beyond just seeing my employees at New Boston Street, because it almost reminded me of 20 years ago when I first started working at NuPath, when I was a much smaller agency. And, you know, because there was staff from the Martin Center at New Boston Street, nurses from the Martin Center at New Boston Street, um, program participants from the Martin Center at New Boston Street. So it was almost like going backwards a little bit, where all the programs consolidated into one place, the headquarters. And so it was a nice, it still is. It's a nice small family feel. Everybody is happy to be back. The hard part is balancing the virtual programming with the in-house programming, because we're trying to, you know, we're running regular programming activities. We're offering current events while we're in the program. We're offering art class. We're offering fitness. We're offering COVID readiness programming. So I'm reviewing and reminding about training with hand washing, with social distancing, wearing the mask, how to properly wear it. And believe it or not, most of the program participants are doing an outstanding job with that. And the employees as well, all the employees. And then what I find challenging is balancing that, because many of the program participants that are here now in the building were previously in our virtual programming. And so they still want both. They want the best of both. They want to be here at NuPath in the physical space. They want to be, you know, in the NuPath family. And at the same time, they also want to be at the virtual programming, because that's where still a lot of their friends are still at, the virtual program, who haven't returned yet. So it's trying to balance that. We don't want them to come to the building just to sit in front of another screen. So we don't do any, we haven't done any group outings. We're not at that point yet. We'll do it more one-on-one individually, and rotate it to get people out in short trips in the community to parks. The full programming hasn't resumed to where it was prior to COVID-19. And, you know, so the volunteer work, a lot of the employment opportunities have not returned yet. So it's really leisure activities, academic, current events, and health and safety that we're focused on right now during this first phase of reopening with the activities. And the individuals have been very, very cooperative. We keep the same cohorts together. So the groups don't mix. Once they arrive to the facility, they're not mixing with other groups. They're not sharing supplies. They're not sharing activities. So I think we've done a very good job with you know, maintaining all the guidelines.
James, about that, those cohorts, I think that's so important to know. Do you maintain them all week long? I mean, are you pretty consistent, or do you mean once they get here to the program?
Well, with the first couple of weeks, we've been able to keep it consistent. The challenge is when more people begin to attend. And every week we're seeing a couple more families, program participants who want to return, who change their mind. It's a gradual increase. About 1 to 2 people we've been seeing every week adding to our roster.
So one of the things that, Ted, you maybe you've got something to say about this, but I know that a lot of the academic, you know, some discussions around returning to school, or, you know, creating a hybrid. One of the possible models is this idea that you keep these cohorts of people together over, you know, for 2-week periods of time, or some period of time, so that if for some reason somebody did get infected in one of those pods or one of those cohorts, it wouldn't necessarily cross-contaminate. And so I just was wondering if that was part of the thinking behind, you know, keeping these, you know, sort of discrete groups of people together. Is that part of the plan, or is that just happening accidentally?
Yeah, that's part of the plan and the guidance. That's the guidance from the Executive Office of Health and Human Services for that reason exactly. And so, as James mentions, the cohorts are, the initial cohorts are based on social and need, right? That we want to equally base that. And as more people come back, it's more of that social element that comes into play of, that someone already in a cohort group, they may have new friends coming back. They're in a different cohort group, and how to balance that, because you know, um, beyond the services, it's also getting back to the social, that their social relationships that they've missed as well. So I can see where that's going to be a challenge in the future, but this safe reopening does rely upon the discipline that James discussed, and making cautious decisions that if a point in time comes where it makes sense to adjust the cohort groups, that we're doing in a sensible way, a necessary way, but also in a way that allows for consistency over an extended period of time. Mixing of the groups would not work for contact tracing, and that's one of the things that if we get a case or a suspected case, that we're going to be diligent, that we're taking attendance when people come in, but we're also taking a second layer of attendance in the cohort group as well, so that we have the information at our fingertips to do any kind of tracing that we need to do.
James, you mentioned that you've had some families begin, after the initial opening, and I mean, part of the hope here and part of what we're trying to do, maybe in some ways, is to continue to educate our wider community around, all the various things that have been put into effect or that we've been thinking about to make sure their son or their daughter, or their family member is safe. Can you think of anything? And I guess this is kind of a kind of question I'd ask, because maybe it's not going to look good for us depending on your answer, but have we had any major screw ups so far? Has there been any situation that has caused, a family member to be like, maybe a better way to say it is, did anybody start here that decided, oh, it's not for us, or maybe the risk is too great, or people have been mostly consistent as far?
Surprisingly, that's an easy answer. No, not out of New Boston Street. So far, every program participant from New Boston Street that returned has expressed that they're happy they returned, and that they don't have any second thoughts or second guessing of their decision to return. So we haven't experienced any individual who has a change of heart.
That's maybe was kind of what I was wondering, because that would be obviously a sign that something, we talk about how the public perception is so important, because if people's perceptions are that it's not safe, then it may as well not be safe, because then people aren't coming back. We want to make sure that the perception matches the reality in this case, that people perceive that things are safe, they perceive that we're doing the due diligence of keeping the environment's clean and so forth, that we actually are doing those things. So as I've seen signs that that's happening, I've been very keen to kind of talk about them, talk about that, because it's bringing assurance to me as well, because sometimes you can hear something.
And it's right. It's important not that we're all talk, that we actually see the importance of maintaining a clean environment. Because it's important for me to mention that we do have a sanitation monitor, which is an employee that's assigned to go walk around the program throughout the day and remind everybody, including employees, program participants, about, did you wash your hands? When was the last time you washed your hands? To randomly wipe a high touch area as they pass through. So the sanitation monitor is constantly walking around the building, assisting everybody to maintain a safe, clean environment. And then we also have the spraying that goes on in between. If a new group goes into the art studio, we will not permit them to enter the art studio until that room has been sanitized. So in between each group, each program area is sanitized, and it's, everybody sees it. If it doesn't happen, which I haven't seen yet, somebody's going to catch it. The sanitation monitor, myself, we have ample resources at this time for the beginning phase of reopening to make sure that we're adhering to all the guidelines, and we're available to assist any of the program participants who may need it. And so far, I just give kudos to the management team at New Boston Street and Martin Center and Westford, because everybody has played a role with the successful reopening.
In the couple of minutes that we have left here, I just wanted to hear from you both your thoughts on the idea of kind of this move towards universal testing, and just knowing what you know about employee behavior, our public perception of things, and just the sometimes the challenge of doing anything in mass, whether that's getting MAP certified or getting trained on some prerequisite training. It's not easy to get it done like in full compliance. Nothing's easy to do, and if we're looking at anything that's close to some of the DPH sort of guidance and their standards that were affecting nursing homes and long-term care facilities, where some agencies were fined if they didn't have everybody tested, or they lost a certain amount of billable units per day. I mean, there were consequences. I don't know if that's going to be the case, but what do you guys see being particular challenges, or what do you think our employees' response to things are going to be? James, why don't you first, and then Ted, maybe talk from a higher level.
Right. So my first thoughts about the testing is that it should be a good thing, because we want to keep everybody safe, and if we can be proactive and be ahead of it, then that's the best for everybody. My second thought is, well, what kind of tests are they offering? Because I've heard that the test that they stick the swab in your nostril, I couldn't imagine having to go through that every day. I mean, I would imagine that would be that would be most of everybody's concern is, do we have to go through that every day?
Yeah.
So it's really what type of testing would be my concern.
James, have you had the test?
No.
You haven't had the test.
I haven't.
And I know what that feels like. That it's not pleasant. But so I mean, maybe it's just as basic as the fear of having something this long jammed down your nostril, into your
That's my fear.
Well, yeah, I wanted to go through because I wanted to see what everybody was talking about, and whether or not it's. I wonder if that's not really what's causing a lot of the kind of any resistance that we're hearing. And what are your thoughts about that? Do you like long big stuff up your nose?
Well, I think there's good news. One, that there are 3 different versions of the test now, right? And there's the long swab. I live in Marlboro, and we were designated as one of the Stop the Spread communities. And so I've been able to observe a couple of things that have been surprising. And that is, if our staff, as a microcosm of the larger community, behave in the same way as I've seen the larger community behave, with the free testing, people are waiting 3 hours in a line at Marlboro Hospital to get that test, which to me demonstrates personal responsibility, that they're taking that amount of time out of their day. In addition, also, I'm sure there's, personal reasons as well, comfort reasons for themselves. But, to see that kind of commitment is impressive on the community side of things. There's the fit test. There's short, where you do the swab yourself. So I think if we are able to find sites where it's either the spit or the small swab, we'll have a much higher degree of compliance with that, and much less fear. In terms of, it makes sense. The more people that can be tested, it does stop the spread. And for NuPath in particular, that if we periodically can get a sampling and identify asymptomatic cases before they get through our best practices that we're implementing, then it's just going to keep our staff as well as the people we support safer.
I think that if we could get to a point where getting the test result was the equivalent to getting your temperature taken, I think that could have such an impact in how we're and all that we'd be able to do, because, if you have, I mean, even from a transportation perspective, imagine if to get on the van, you had something, I mean, we may be way away from that if it ever happens, but you were able to ascertain whether or not somebody's been exposed or has it, then you could, begin to transport larger numbers of people to come together, and you'd be able to put them into smaller spaces. Greg, as we wrap this up, are there any questions that have come in that we want to direct to these two subject matter experts that we have on today?
Just one, and Ted touched upon it. And Ted, I don't know if you saw that question come in, but okay. So it was a question regarding, specifically someone at the Martin Center, but I think the question of what our thinking is on the opening of the Martin Center.
Yeah, I can touch on that. The question is, when will we be opening the Martin Center? What are our thoughts with that? At this point in time, we are not denying anyone from any site of services that wants or needs to return. We do have people from the Martin Center who are now getting their services at New Boston Street. And I'd like to say that we've been able to provide equal or better setup in that facility. And that's not to say New Boston Street is better than New Martin Center or vice versa. It's just to say at this point in time, we've been able to set up a custom space. James could comment very quickly on that. But I'd also encourage, if you're holding off because the Martin Center isn't open yet, I would encourage you to take a look on the website of the tour, the virtual tour, and also advocate in the short term. One thing that New Boston Street does offer is Jubilee Park, and to be able to benefit from outdoor activities, it is a benefit during the later summer and especially into the fall. It gives that added opportunity for people at this point in time. And James, in a very nutshell, the Martin Center is going well.
So New Boston Street does have they have programming areas, and because we only have 17 to 18 New Boston Street folks back, we just pretty much dedicated our day hab area to the Martin Center folks. And so we have all the assistive technology, we have the nurses here, so we made all the accommodations. Actually, the accommodations were already set up at New Boston Street because we are a facility that provides day hab services.
Yeah, and I would say that if you are somebody that is, and this goes for staff too, that are thinking about, potentially returning to more of a full-time position, if they're a Martin Center employee that has not yet found alternate placement, I would say don't hold your breath waiting for the Martin Center to open just yet. I mean, we may be a ways away from that happening. And really from a business perspective, we're having to take into account just all of the considerations around occupancy expense. When you're running a site, you're going to be using more electricity, you're going to be having other costs, there's going to be other things to take into consideration, that if we can continue to do that in one location, it's going to make it's going to be much more fiscally smart to do it that way. If you can sort of capitalize on your nurses' shaves.
So one of the biggest surprises with reopening is, I feel that the turn in 22 families was specifically waiting for us to reopen. I just been getting just overloaded with referrals for the last week and a half now, that all of a sudden now we're getting all these turn in 22 referrals with families who want their kids to start attending the program. So I wasn't expecting that.
Wow. Yeah, that's, but you know what? Life doesn't stop. People are turning 20.
No.
People are, and one of the things I was thinking when you were talking a minute ago is wondering if a family member did want to come in and see the environment for themselves in person. I mean, is that something that could be arranged? Because I know what it's like to try to choose a program for.
So, right, at this time, I've been doing virtual tours of the program. I've done 3 since we opened, and I actually got 3 more this week.
Family member? Is that what you mean by virtual, or like you walk around with them on an iPad or something? Or?
Yes, I start in Jubilee Park. I walk around the perimeter, make my way just like if it was a real talk. The person was there with me.
Mm-hmm. Nice, nice. I was wondering if, people from, if their kid maybe attended the Martin Center and they're feeling a little bit unsure, to see it with their own eyes might help, but probably virtual, yeah, that's the way we have to go, isn't it? We can't be, bringing people in. I mean, I know that, it's affecting so many different, areas of, healthcare. People not being able to, actually get in and see something with their own eyes. I'm still a really tangible person, so I like to see something for myself, but I think the virtual stuff is probably the way to go. Well, is there any other thing that you that we should talk about or mention today? And if not, I'll wrap this up.
The only other thing I'd just like to plug, that for those people who are not returning, who are not ready to return at this point, the virtual programming is continuing. And if there's an access issue, absolutely reach out to your program supervisor. We have provided over 50 Kindle Fires, and we have others in stock that we're able to provide to people during this time. So the accessibility should not be an issue for our virtual programming. If you want to see what's being offered, you can go to our website, nupathinc.org, and right on the screen, you'll see the link for the virtual programming calendar on a weekly basis. And we promise you, one of our core values is innovation, and we're looking at this challenge. We're not just kind of, packing up and, waiting for it to pass, that in the coming weeks, there will be more and more, hopefully options for people to continue to receive their services in a safe way, in addition to the in-person as well as the virtual programming.
Ted Horn, thank you so much. James Hannon, appreciate your taking the time to be with us today and providing us with the information that you have. And sure, our broader community thanks you both too. So thank you both.
Thank you.
Thank you.
Thanks. All right. Well, I think that's a good place to kind of end. I will just reiterate what Ted said. I think that's a good place to end, actually, is that we're not just, NuPath is not just finding a workaround or patching things together, hoping for, some medical, emergence of some vaccine tomorrow or the next day. We believe it will happen eventually, but as we've said many times over, we have to really figure out how to lean into this thing and to get through it safely and as robustly as we can. To hide at home is certainly not something that we're advocating, but we also are trying to urge an abundance of caution, as they say, in how we return. So my hat's off to the most incredible team that you could ever hope to encounter. These guys have been at it since March and sort of defining our virtual programming, and now helping to guide us as we reopen safely and in a way that ensures that people are going to be able to continue to come and to do so safely. That's a commitment that we have to everybody, to our families and to our clients and staff. If you're a staff person out there and you are considering a return or looking for some sort of a long-term or more sort of permanent placement, you should be thinking about that, because we need as many people as possible to fill some holes in residential, and knowing that there'll be employment opportunities there for a very long time. All right, unless there's anything else, Greg, I think we'll go ahead and sign off. I'm going to wish everybody, again, continued use of every protective and every measure to try to social distance, and wearing your masks, as we know, is so important. I know that we've got this together and we will get through this. So let's do it, guys. We'll talk to you on Thursday for our weekly Unity Forum, and we'll see what surprises we have there. All right. Thanks, everybody. Bye-bye.